You're walking across the room, nothing unusual, and suddenly you feel it. A slight wobble. A moment where your body doesn't quite respond the way it used to. You catch yourself. Maybe you even laugh it off, but something lingers in the back of your mind. Was that normal? Now, if you've had even a few of these moments recently, I want you to stay with me. Because what most people dismiss as harmless can quietly become something much more serious over time. I've spent over 4 decades in medicine, and I can tell you this with certainty. The loss of balance doesn't usually happen all at once. It creeps in, slowly, subtly, and most people don't notice it until it begins to affect their confidence, their independence, and in some cases, their safety. Now, before we go any further, I should say this clearly. What I'm sharing with you comes from my experience as a physician. It is not personal medical advice. Every individual is different. And if you're concerned about your balance, dizziness, or risk of falling, you should speak directly with a qualified healthcare professional who knows your medical history. If you find these kinds of discussions helpful, you might consider subscribing. Not for quick fixes, but for clear, thoughtful explanations that help you understand what your body is doing and why. Let me describe something I hear often from patients. They say things like, "I just feel a little unsteady. Sometimes I need to grab onto something. I don't trust my footing the way I used to." And occasionally, I've started avoiding stairs or going out at night. Now, this is where it becomes important. Because these are not just small inconveniences. They are early signals. And this is where most people make a mistake. They assume it's simply aging. Of course my balance is worse. I'm getting older. But that explanation, while comforting, is incomplete. Yes, aging plays a role. But in most cases, there are specific, identifiable factors underneath it. And many of them can be improved. So let me walk you through what's really going on. First, your inner ear. This is your body's balance center. Inside it are tiny structures that detect movement and orientation. Over time, these structures can become less sensitive, or small particles inside them can shift out of place, leading to brief episodes of dizziness. Sometimes it's subtle. Other times, it feels like the room is spinning. And this is where people often say, "It comes and goes." Second, muscle strength. Balance is not just about your brain or your ears. It's about your muscles responding quickly and effectively. After the age of 50, muscle mass naturally declines. But here's the critical part. It's not just strength you lose, it's reaction time. So when you trip or shift your weight suddenly, your body is slower to correct itself. That delay, even if it's just a fraction of a second, can be enough. Third, vision. Now this one is often overlooked. Your eyes constantly send information to your brain about where you are in space. But as vision changes, especially depth perception, your brain receives less reliable information. And when your brain is uncertain, your balance becomes less stable. This is why many people feel more unsteady in dim lighting. Fourth, nerve sensitivity in your feet. This is something I always check in my older patients. The nerves in your feet tell your brain where the ground is, how firm it is, how your weight is distributed. Conditions like diabetes, or even normal aging, can reduce this sensitivity. And when that happens, You're essentially walking with less feedback. Imagine trying to walk on uneven ground with thick gloves on your feet. Fifth, medications. Now, this is a big one. Certain medications, especially when combined, can affect balance, alertness, and blood pressure. Sedatives, some blood pressure medications, even certain antidepressants. They don't always cause obvious dizziness. Sometimes it's just a slight slowing, a slight disconnection between intention and movement. And over time, that adds up. Sixth, blood pressure regulation. You may have experienced this. You stand up, and for a moment, you feel lightheaded. This is called orthostatic hypotension. Your blood pressure drops briefly, and your brain doesn't get enough blood flow for a few seconds. In younger people, the body corrects this almost instantly. But with age, that response can become less efficient, and that moment can be dangerous. Seventh, joint stiffness and posture. As joints lose flexibility, your posture subtly changes. You may lean slightly forward or shift your weight differently, and this changes your center of gravity. Now, your body has to work harder just to stay upright. And this is where many small balance issues begin. Now, let me add something deeper here, because this is not just physical. There is also a psychological component. Once someone experiences even one fall, or a near fall, the brain remembers it, and it becomes cautious. That caution can turn into hesitation, and hesitation, ironically, can make balance worse. So what we're really looking at is not one single cause. It's a combination. Your inner ear, your muscles, your vision, your nerves, your medications, your circulation, your posture, all working together. Or, in some cases, not quite working together as they should. So what can you actually do? Let me give you a simple framework. Not complicated, not overwhelming, just practical. First, strengthen your legs. Even light resistance exercises, done consistently, can significantly improve stability. Second, challenge your balance safely. Standing on one foot, holding on to something if needed. Simple exercises like this train your body to respond faster. Third, review your medications. Not by stopping anything on your own, but by asking your doctor a simple question. Could any of these be affecting my balance? Fourth, take your vision seriously. Regular eye exams, proper lighting at home. These small adjustments make a meaningful difference. Fifth, pay attention to how you stand up. Don't rush it. Give your body a moment to adjust. This alone can prevent many falls. And this is where most people underestimate the risk. They move too quickly, assuming their body will keep up. Finally, stay aware, but not fearful. There's a difference. Awareness leads to better habits. Fear leads to restriction and loss of confidence. And confidence is actually part of balance. If you take one thing from this, let it be this. Losing your balance is not just getting older. It's your body asking for attention in very specific ways. And when you respond early, the outcome can be very different. Take care of your body, and it will support you longer than you think. And if this helped clarify something for you, you can subscribe for more conversations like this. Not rushed, not exaggerated, just careful, honest explanations. The way I've learned to give them over the years.